Welcome back to DXB Today. Tonight we are delving into the future innovations in the world of healthcare, which is very important to all of us, and that's why we welcome our next guest, who is the medical director of the UAE's first private medical workspace platform managed by Dubai Healthcare City. Please join us in welcoming Dr. Mohamed Elbaz. Dr. Mohamed, thank you so much for being with us.
Thank you very much for inviting me.
So we'll talk about C37. Can you tell me what it is? Exactly, like for me to understand.
Exactly. So actually C37 proudly say that it's the first private medical workspace, and it's a new platform managed and operated by Dubai Healthcare City Authority. And actually C37 is giving a 360 solution for the UAE-based doctors and the international clinical physicians who would like to practice independently and privately in Dubai, and they don't know how to start. So C37 gives them a lot of solutions to how to be guiding them to come to Dubai and start their own independent clinical practice. Yeah.
That's amazing. I've known a lot of doctors who want to come to Dubai and they don't know where to start. But let's say they come and they join C37. What's the period where from the start to they actually start being able to work here in Dubai?
As you know, Dubai in healthcare industry in Dubai, it takes a little bit longer to be join any other healthcare facility, but in C37 we break the records to reach to 72 hours, and you can be a member of C37 if you are eligible and you have the DHA eligibility and you have the full documentation and all paperwork is done. Is 72 hours to be part of C37.
Incredible.
Yeah.
Dr. Mohamed, I'm interested to know what kind of doctors or specialists is C37 designed for?
It's a great question actually, because C37 have more than 60 plus specialty added on to our medical facility, and thanks for DHA actually for helping us to have all of that specialty. It's an attractive for everyone. It's an attractive for a medical part and allied healthcare as well. So if you are a physician with specialty or subspecialty, or you have an allied specialty under CDA or DHA, you can join C37. And it is well designed and giving them, as I say, 360 solution for everything as a shared service. If you require medical staff, supportive, if you would like a medical consumables, amenities, utilities, everything is providing them from A to Z. And also, C37 is covering them complementary with the malpractice insurance, which is the most important thing for any physician, however your specialty, to have to be covered by that. And it's covered up to 5 million dirhams as well.
Incredible.
Yeah.
Dr. Mohamed, how is C37 helping out with Dubai Healthcare City in advancing the wellness and the healthcare excellence right here in the UAE?
C37 DHCC, actually we have a mission of being an attractive platform for the international physician, and C37 help too much on that, being a direct place as a healthcare facility to attract the international physician who are seeking an opportunity in Dubai. As I say, it's just 72 hours to be part of Dubai. Number two, it's giving them the opportunity to grow with the solutions surrounded by them, because C37 providing them everything from regulation until operation. So whatever they require as an international physician, they don't know anything about Dubai market, so we help them to be part of the community, as well as help them if they have a dream to have their own medical facilities later on after experiencing the healthcare market, they could be. And guess what? We have a lot of success stories who are being members, doctors have been members of C37, and successfully they open their own medical facilities in Dubai Healthcare City. And this is actually what we are seeking for. And that's also helped the Dubai Economic Agenda, which is D33, to transform Dubai to be the hub of the healthcare investors and talents.
So the idea is to bring more world-renowned specialists to Dubai quicker. When they come here, do you already have a placement, or will C37 maybe also help them with a placement going forward?
As we mentioned, C37 is the gate, and the doctors, they have the choices to be part of C37 as a full-time or part-time. Full-times mean on the physical practice. They might be a full-time doctors working with C37 forever. But again, C37 also, it's a choice for the doctors who are coming from outside the country to practice the healthcare market to be more popular than it can be help them to innovate their own clinical spaces as well. They can open their own medical facilities, and we can help them to open it in Dubai Healthcare City buildings. So this is how it works with C37.
I'm sure any physicians who might see this will be wondering what C37 gets back in return. What's expected from the doctors for all this help that they'd received when they first arrived?
So you talk about the patients itself?
Talking about what the C37 would get back, would there be a subscription fee, or is this just to attract people to the country?
Okay, as we mention all the time, the first customers of C37 is the doctors, equal for them the patients. And of course, we have a membership packages. This membership is an hourly base. And why we make it an hourly base? Because we need the doctors to be relaxed, not to be under attention, not to be paying a rent. So that's mean they will be accessing C37 in an hourly base. Whenever they need to see a patient, whenever they need to consult or treat or to give any kind of medical treatments requirements, they can access C37. So it will be an hourly base. And that's help them also not to be exit from their countries to be permanent in Dubai. No, also they can be 100% practicing as an international visiting physician. So they can work in their own countries, they can practice and expand in Dubai through C37 platform. And with this membership, actually, it's give them the accessibility to all and everything inside C37. And we are providing them with all kind of support, clinically and administrative. So they require customer service, call center, nursing staff, amenities, utilities, medical devices and equipment, and also the ecosystem, what we have in DHCC, in specific for C37, it's engaging and connecting the doctors with all other medical facilities required to treat their own patients. So the patient journey also will start and end at C37 itself. And that's also give an access to the patients to make their life more easy, and also help the doctor to provide the best quality of care, not to think about how can I cover my expenses, because the expenses will be very minimal comparing to what they can expect from the patients. And also the most important thing and the most important idea out of C37, the quality of care. We need to change the healthcare industry, and also to develop the clinical service, and also to create, maybe it's now a small community, but actually our dream and our plan is to expand in the whole Dubai, and we will have soon another satellite clinics, another C37 in other part of Dubai.
Incredible.
Thank you so much, Dr. Mohamed. This sounds very exciting. I'm sure a lot of physicians who are watching us right now here and around the world would be very excited about C37 and how it's beneficial for us residents as well. Thank you so much for joining us on the show.
My pleasure. Thank you very much.
But now I gotta throw things to Amy, because Amy's got the quiz for us.
Yes, now it is time for DXB in 60. Vadim, we have learned all about Bionic on today's episode, but we want to get to know you a little bit better. So we're going to put 60 seconds on the clock. Quick fire questions, let's go. So one myth that you would like to bust about health?
One myth is that if you are in the sun or live somewhere where it's warm, you don't need to take vitamin D.
That is a good one. Your motto in life and in work?
Hire for the will, not for the skill.
Amazing. If you could have an AI assistant, what tasks would you ask it to handle?
Anything that is detailed where I need to follow up or write emails, I will definitely delegate.
If you could have dinner with anybody, dead or alive, who would it be?
Michael Jordan, he can't beat the GOAT.
True, true. The best part of your job?
To be able to impact people's health and see the improvement and be part of their journey to reach their real private health goals.
The best advice that you've ever been given?
Don't speak until you're asked.
Very good one. Your go-to restaurant in Dubai?
Cyrene by Gaia.
Very good choice. And last question, why Dubai?
You can't beat innovation. It's safe, I get goosebumps talking about it, but now I need to stop promoting it because there are so many people coming over here that the traffic's getting too much. But it's the best place in the world and I wouldn't change anything.
Vadim, thank you so much for being on DXB today, and thank you so much for teaching us all about Bionic.
Thank you guys, thank you.
Sure, we'll see you again. And Dr. Mohamed, thank you so much for the work you've been doing with C37. Thank you for being on the show.
Thank you very much. Thanks for having me.
But for right now, thank you for watching the show. Don't go anywhere though, because we do have some music for you. So make sure to stay tuned, because Mr. Lee Wall is on the way.